Hi guys, let's see about leptospirosis. It is a zoonotic infection caused by gram-negative spiral-shaped bacilli, spirochetes, namely the Leptospira introgans and Leptospira biflexa. The reservoir here is rodents mainly, followed by cats, dogs and other livestock. The risk factors are rodents and conditions like rainfall and floods, which causes the rodents to move from their burrows into the water bodies and contaminates the water bodies and soil with their urine, rice fields, and people involved in recreational water related activities. The mode of infection here is the human host comes in contact with the water bodies which is contaminated with the infected animal's urine. This causes this bacteria then enters the human body through abrasions or cut in the skin or mucosa and spreads hematogenesis. Pathogenesis is it causes damage to endothelium of the blood vessels and immune complex deposition. This can lead to multi-organ failure. In the clinical picture, the incubation period is around 10 days and it can present as mild leptospirosis mostly. It can also present as severe leptospirosis. In mild leptospirosis, it is mostly asymptomatic, and in symptomatic cases, we can have anecdotal febrile illness which is characterized by fever with chills and headache which can be retroorbital pain, nausea and vomiting, myalgia predominantly involving the back and the calves. Conjunctival suffusion is very particularly seen in leptospirosis. It is not associated with any eye discharge and rash can also be seen. Usually it resolves within 7 to 10 days and the treatment is doxycycline 100 mg twice daily for 7 days. Severe leptospirosis, it usually manifests as hepatorenal syndrome. It is called as the Wales syndrome. It has 3 components: jaundice, there is mild elevation of transaminases and hepatomegaly can be seen, and hemorrhage, it is due to thrombocytopenia, and hemorrhage in the form of pulmonary hemorrhage and GI hemorrhage in the form of melena can be seen. Skin hemorrhage and petechiae can also be seen. And renal manifestation is acute tubular necrosis. It causes a non-oliguric presentation most commonly. It is characteristically associated with hypokalemia and hypomagnesemia. And we can have immune-related manifestations like aseptic meningitis, myocarditis, rhabdomyolysis, and uveitis. The treatment is penicillin 1.5 million units IV for 7 days. Investigations for the first 5 days are Leptospira PCR, and following that we can do IgM ELISA, and the gold standard investigation is microscopic agglutination test. Thank you.